Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important, because if they vomit and aspirate they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheetos at reception, and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. Nurse here had a patient accuse me of shitting in her bed and threatened to sue me for malpractice. Keynote, she never got out of her bed. Nursing assistant here, I've been accused of shitting in the corner of a patient's room. She did it and then tried to blame some really nondescript man as the culprit after realizing no one believed it was me. I've also been accused of killing babies and burying them in the hospital basement. I admitted a guy for chest pain. As part of the workup, I did a urine drug screen which came back positive for cocaine. After the rest of his cardiac workup was negative, I said to him, "Good news, you didn't have a heart attack. It's likely that your chest pain was caused by cocaine." His answer, "I didn't use cocaine. See, I was at a party and people had some lines of cocaine out on a table. As I was walking by, an oscillating fan blew the cocaine into my face, which is why my urine was positive. MMMHMM. Got it." It's well known in the that a patient with something stuck up his/her/etc, but has no idea how it got there, or they fell on it. The weirdest thing I saw was a patient who came into the ED with a shampoo bottle up his butt. So, what brings you into the emergency room tonight? I shoved the shampoo bottle up my butt, now it's stuck there. No shame. Other than all the random things that end up in rectums accidentally, drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip. Denied owning any drill bits or for that matter having been drinking. Most common are the numerous drug/tox screens we do that come back positive for something and everyone is shocked, borderline offended it got into their system. Being pregnant and also a virgin. People actually believe women can get inseminated in a public pool or after their parents had sex in the jacuzzi and the girl uses the jacuzzi and is inseminated by the father. Only work records in a clinic, but we had a woman come in with a report of vagina loader. All well and good, it happens all the time in an ob/gyn clinic. What she hadn't bothered to say was that she'd gotten a tampon stuck around the end of her last period. She'd gone through menopause 7 years prior. My patient presented over several months with recurrent huge abscesses that we couldn't explain. She was in horrible pain. Had to stop working. We tested for everything. Eventually her husband called me that he found syringes in her medicine cabinet. We think she was injecting herself with fecal matter. When the syringes were found she stopped coming to her appointments. To those asking why, I think she has Munchausen syndrome. She wanted the attention from being sick. I started getting suspicious when she always would get a new abscess before any court dates, CPS problems, and need a doctor's note to get out of it. She denies everything, and it's very hard to have someone committed unless they are acutely suicidal. I'm vet student. Many clients like to say I don't overfeed my dog/cat. That's just their normal size. When their pet looks like a watermelon. Not a doctor, but work in an One day some pretty young parents brought their toddler in because he was super lethargic and not responding to any stimuli and the parents said they had no idea why. The staff were pretty concerned for him because those symptoms are a pretty big red flag for small kids. So we start running a bunch of tests including a drug screen which ended up being positive for THC. The doc goes and talks to the parents about it, and they finally broke down and admitted that the kid had eaten an entire bottle of their weed gummies while they weren't paying attention a few hours earlier and was just high as shit lol.